Imagine this for a moment. You are sitting alone in your living room. The house is quiet, and then it hits you. A heavy pressure in the center of your chest. Your breath shortens. Your left arm feels strange. Most people think they would stay calm, but the truth is far more frightening. Thousands of older adults in America lose their lives each year because they do not know what to do in the first 60 seconds of a heart attack when they are alone. And those 60 seconds often decide everything. I am Dr. Michael Carter, and what I am about to share with you may shock you. A major heart study found that seniors who act correctly in the first minute increase their chance of survival by more than 70%. Yet almost 9 out of 10 people over 60 have no idea what the right steps are. They panic, they freeze, or they do the wrong thing at the worst possible moment. But here is the hopeful part. You do not have to be helpless. There are 7 practical steps, backed by science, that can keep you alive long enough for help to reach you. Simple actions you can do at home, even if you are completely alone. And the most powerful tip is waiting at the end of this video. Stay with me until the final section, because it may be the one thing that saves your life one day. Before we begin, tell me in the comments where you are watching from. And if you find value in videos like this, I invite you to subscribe to Life in Words so you never miss important health guidance for older adults. Now, let us take a deep breath together and step into the first essential part of this life-saving guide. When a heart attack begins, the body changes faster than most people realize. Your brain starts losing oxygen within seconds. Your hands may shake, your thoughts become cloudy, and even simple actions like dialing a phone number suddenly feel overwhelming. That is why having an emergency communication system ready before anything happens is not just helpful, it is essential for survival. Most older adults believe they would be able to call for help right away. But studies tell another story. Many survivors report that within 30 seconds, they could not remember their own address. Not because of memory problems, but because oxygen loss shuts down the parts of the brain that help you think clearly. This is why preparation is your strongest ally. Here is the first step. Write your full home address on a bright card and place it next to every phone in your house. Your brain under stress needs simple cues. A small card can save precious seconds. And if you ever feel symptoms coming on, those seconds may be life itself. Next, program your emergency number as a single touch button on your cell phone. Your fingers may tremble. You may feel lightheaded. Pressing one button is always easier than pressing 3. It sounds simple, but simple is exactly what your brain needs during an emergency. Another powerful tool is a medical alert device. Many seniors buy one, but do not wear it consistently. Some take it off to shower. Some remove it at night. And sadly, many heart attacks strike during those quiet hours when the device is sitting on a table instead of being on your wrist. Choose one that is waterproof and wear it constantly, even in the shower, even in bed. Let me give you a gentle reminder. If this information feels important to you, type the word "ready" in the comments so I know you are following along. Your comments also help more seniors discover videos like this. Now here is something many people overlook. Tell a trusted neighbor about your heart condition. Let them know your routine. Give one neighbor a spare key. If they hear unusual noises or notice you have not stepped outside as usual, they can check on you or help paramedics enter your home quickly. When you live alone, community becomes part of your safety plan. And do not forget apartment buildings. If you live in a high-rise, make sure the front desk, building manager, or security guard knows your medical needs. They can guide emergency crews to your door without losing minutes searching hallways. For people over 60, minutes matter more than ever. Take a moment right now to picture this. You are experiencing chest pressure. Your heart is racing. You reach for your phone. Your vision blurs slightly. But because you prepared, your emergency steps are already in place. Your address is visible. Your phone is set up. Your neighbor knows what to do. Instead of panic, you move into action. Preparedness turns fear into survival. This first step may feel simple, but it lays the foundation for everything that comes next. And in a real emergency, your ability to call for help quickly will determine whether the 6 remaining techniques have a chance to protect you at all. Now, let us move gently into the next life-saving strategy, one that surprises many people because of how unusual it sounds. But when done correctly, it can help you stay conscious long enough to call for help. We will explore that in the next section. There is a moment during a heart attack when the world can suddenly tilt. Your heartbeat becomes uneven. Your vision may dim for a second. Your chest tightens. This is often the point when many older adults collapse before they are able to call for help. But there is one technique that can help you stay conscious a little longer, just enough to dial your emergency number or take life-saving medication. It is called cough CPR. And although it sounds unusual, it has been studied for years. When your heart rhythm becomes unstable, strong and repeated coughing can temporarily help push blood through the body, keeping oxygen flowing to your brain. Think of it like giving your heart a tiny assist while it is struggling to keep up. Here is how to do it the right way. At the very first sign of severe chest pressure, dizziness, or irregular heartbeats, take the deepest breath you possibly can. Fill your lungs completely, then cough. Not a soft cough, a strong, forceful cough from deep inside your chest. Imagine you are trying to push something stuck at the bottom of your lungs. Breathe in again, cough again. Repeat this rhythm every 2 seconds. Deep breath, strong cough, deep breath, strong cough. This repeated cycle creates pressure inside your chest. Each breath pulls oxygen into your lungs. Each cough squeezes your heart and helps keep blood moving. For some people, it buys them up to 1 extra minute of consciousness. 1 minute may not sound like much, but during a heart attack, 1 minute is everything. Let me pause for a moment and ask you something simple. If you are still watching and learning, type number 1 in the comments. It helps me know you are here, focused, and taking in this essential guidance. Now let me be very clear. Cough CPR is not a replacement for calling emergency services. It will not cure a heart attack, and it does not work in every situation. It is most effective only in the earliest moments of certain rhythm problems, when you are still conscious and when your arteries are not completely blocked. If your symptoms suddenly intensify, if you become lightheaded, or if pain spreads across your chest, stop coughing and sit down immediately. Your priority must always be alerting emergency services, then positioning your body safely. But when used properly, this technique can help keep the world from fading too quickly. It can help you stay awake long enough to make that life-saving call. And for many older adults who live alone, that tiny window of time can be the difference between rescue and tragedy. Now that you understand how to buy yourself a few more seconds of awareness, let us move forward to something just as important. The next step involves a tiny pill that almost every household has, but very few people know how to use correctly during a heart attack. Use the wrong way, it slows your survival. Use the right way, it protects your heart when you need it most. When a heart attack begins, time is no longer measured in minutes. It is measured in heartbeats. And one of the most powerful tools you can use during those first moments is a simple aspirin. But here is the surprising truth. Most people take it the wrong way, and that mistake can cost precious time. A heart attack usually begins when a clot blocks blood flow through a coronary artery. Aspirin does not dissolve the clot, but it prevents it from getting bigger. It makes the blood less sticky, giving your heart a slightly clearer path to push blood through, but only if you take it correctly. The right method is simple. You must chew it, not swallow it. Chewing allows the aspirin to enter your bloodstream through the lining of your mouth. This makes it work faster than waiting for your stomach to break it down. When your heart muscle is starving for oxygen, faster is everything. So here is what you do. Take a regular strength aspirin, about 325 milligrams, or 4 baby aspirins. Put it in your mouth and chew thoroughly. Yes, it tastes bitter. Yes, it feels chalky, but that bitterness may be buying your heart the time it needs. Let me add a small reminder here. If you are following the steps in this video, type the word heart in the comments. Your interaction helps this information reach more seniors who may need it one day. Now, there are a few important cautions. If you are allergic to aspirin, do not take it. If you take blood thinners, your doctor should guide you on an emergency plan. If all you have is coated aspirin, you still chew it. The coating tastes unpleasant, but speed matters far more than comfort. Also remember this. The aspirin you take every morning for prevention is not enough during an actual heart attack. Low-dose aspirin is too gentle for an acute emergency. You must always take a full emergency dose. Keep aspirin in easy-to-reach places around your home, your bedroom, your living room, your purse, even in your car. Check expiration dates every few months because potency matters. Store tablets in their original bottles to protect them from moisture and heat. Picture a real scenario. You are alone. You feel pressure across your chest. Your breath shortens. You sit down quickly. You reach for the aspirin in your nightstand. You chew it. Within moments, the medication begins working its way through your bloodstream, giving your heart support until help arrives. Small actions save lives. A tiny tablet can change the outcome of a crisis, but only if you use it correctly. Now that you know how to activate this powerful tool, let us move into the next life-saving technique. This one does not involve medicine at all. Instead, it is about how you position your body to protect your heart and your brain during those critical first moments. During a heart attack, your body is fighting to keep blood flowing to your brain and heart. Every small decision you make affects how well your body can maintain that flow. One of the most overlooked but powerful actions you can take is simply positioning yourself the right way. Many people instinctively lie flat when they feel chest pain. But lying flat can actually make things worse. It reduces the return of blood to the heart. It can make breathing harder, and it might accelerate the feeling of fainting. Here is the safer choice. Sit upright at about a 45-degree angle. Lean your back against a wall, your sofa, or a pile of pillows. Let your body relax into that angle. Then bend your knees slightly with your feet flat on the floor or bed. This position helps your heart work with gravity instead of against it. It reduces strain on your heart muscle and gives your lungs more room to expand. Let me ask you quickly, if this position makes sense to you, type number 2 in the comments. Small actions like this help keep our community connected and learning together. Now, once you are in the right position, pay attention to your breathing. Short, shallow breaths make your heart work harder, your chest tightens, your anxiety rises. This is when many people begin to panic. But if you stay in the correct position, your lungs open more fully, giving your body the oxygen it desperately needs. If at any point you feel yourself getting dizzy or feel like you might faint, lower yourself to the floor. Do it slowly. Do not collapse. Once you are safely on the ground, lie on your right side with your left knee bent slightly forward. This is called the recovery position, and it protects your airway. If you vomit or lose consciousness, this position prevents choking. It also helps the lungs expand and keeps blood flowing more smoothly. Avoid tight clothing. Loosen belts, collars, or scarves. Anything that restricts breathing or circulation puts additional stress on your heart. Even something as simple as loosening a belt can improve oxygen levels when your body is under severe strain. And here is one more detail many people do not think about. Keep your environment cool. During a heart attack, the body often sweats heavily. If you wrap yourself in blankets or stay in a hot room, your heart must work harder to cool you down. Open a window if you can. Allow fresh air in. But do not go outside where you might collapse unnoticed. Let me paint a picture for you. You are alone. You feel the crushing weight on your chest. You sit upright, supported. You bend your knees. Your lungs open. Your breathing steadies. Your mind becomes a little clearer. You have given your heart the best possible position to keep fighting. This step is all about buying your body time. Time for the aspirin to work. Time for emergency help to arrive. Time for you to stay conscious long enough to survive the critical first minutes. Now that your body is positioned for survival, the next section focuses on how to control your breathing. Because when your breath is calm, your heart follows. And calming the heart during a crisis is one of the most powerful tools you have. When a heart attack begins, fear often arrives first. Your breath speeds up, your chest tightens, your mind starts racing. This natural panic response is the body trying to protect itself. But during a cardiac event, it actually makes everything worse. Fast, shallow breathing reduces oxygen going to the heart and brain. It increases your heart's workload, and it can trigger dangerous spasms in your coronary arteries. But there is a simple, powerful technique that can help you slow everything down. It is called paced diaphragmatic breathing, and it has helped many patients reduce heart strain and stay conscious long enough for help to arrive. Here is how you do it. Breathe in slowly through your nose for a count of 4. Feel your belly expand gently. Place a hand on your stomach if it helps. Then hold that breath for a count of 4. Finally, exhale slowly through slightly tightened lips for a count of 6, as if you are blowing out birthday candles in slow motion. 4, 4, 6. A calm, steady rhythm. This longer exhale is the secret. It activates the part of your nervous system that relaxes your body. Your heart rate begins to slow, your blood vessels soften and widen, and your oxygen levels become more stable. Let me pause for a moment. If you are still with me and practicing this technique right now, type the word calm in the comments. Your participation may help someone else notice this step and learn it too. Now, let us add something important. When anxiety rises, the chest often takes over the breathing. But chest breathing is shallow and fast. It feeds the cycle of panic. Diaphragmatic breathing, the kind we are practicing, signals safety to your heart and lungs. Put one hand on your chest and one on your belly. The hand on your belly should rise more with each breath. If your chest is lifting too much, slow down and refocus on the belly. Practice makes this technique easier. Trying to learn it in a crisis is difficult, but practicing a few minutes each day trains your body to use it naturally when fear surges. Your body remembers what you teach it. Let me give you an example. Imagine you are sitting alone, and that familiar pressure begins in the center of your chest. Your breath jumps. Your hands tremble. You sit upright, just like we practiced in the last section. Then you place a hand on your stomach and begin the breathing pattern. 4 in, 4 hold, 6 out. Within a few cycles, your shoulders drop slightly. Your heart slows. Your chest feels less tight. You regain enough clarity to reach for your medication or call for help. In many cases, this kind of controlled breathing reduces the severity of symptoms, not by curing the heart attack, but by reducing the oxygen demand on the heart muscle. When the heart is struggling, giving it less work can buy precious time that may save your life. Here is another helpful tip. If you are on the phone with emergency services, count your breaths out loud. It shows the dispatcher that you are still conscious and breathing. It also helps them assess the severity of your condition and guide you more quickly. Controlled breathing may sound simple, but during a heart attack, it becomes one of the most powerful tools you have. You are calming your mind, protecting your heart, and slowing down the storm inside your chest. Now that we have learned how to stabilize your breathing, we need to address something most people never think about until it is too late. A single locked door has taken countless minutes away from emergency workers trying to reach someone in distress. In the next section, we will talk about a step that feels small but can be life-saving, opening the path that allows help to reach you in time. This next step may be the most overlooked life-saving action of all, a step so simple that many seniors never think about it. Yet thousands of older adults lose their lives each year because emergency responders reach their home and cannot get inside. A locked door can steal the minutes your heart desperately needs. When a heart attack begins, your strength fades quickly. Your legs weaken. Your coordination slips. Most people lose the ability to walk within just a few short minutes. That is why unlocking your front door must be one of the very first actions you take when symptoms appear. If you feel chest pressure, shortness of breath, or sudden discomfort across your arm or jaw, stand up carefully and go straight to your door. Unlock it. If you can, leave it slightly open. This small action can save up to several minutes when paramedics arrive. Let me pause here. If this step surprises you, type number 3 in the comments. Your response helps spread this message to more seniors who need it. Now, think about this clearly. Once you sit down or collapse, once dizziness takes over, once your legs fail you, you will not be able to reach that door again. And emergency responders cannot break into every home they visit. Many must wait for building managers, wait for tools, or wait for clearance. While they wait, your heart is still under attack. You can prevent that by preparing today. Here are a few ways to make your home rescue ready. Install a lockbox outside your door and share the code with your local fire department. Attach a bright tag or small ribbon to your door during the daytime when you call for help, so paramedics spot the correct house instantly. Turn on all your indoor lights if you can. A fully lit home stands out immediately, especially at night. If you live in an apartment building, call emergency services first. Then call your front desk or security so they can guide the ambulance directly to your floor. And here is something even more important. Keep a small information sheet taped behind your front door. Your name, your medications, your allergies, your conditions. This helps paramedics understand your situation the moment they enter your home. Let me give you a real picture. You are home alone. Chest tight, breath short. You unlock the door. You turn on your lights. You sit back down and begin controlled breathing. Your emergency path is open. Your rescuers will not lose time searching or forcing entry. They can reach you immediately. Time is the most precious resource during a heart attack. You cannot buy it. You cannot borrow it. But you can protect it. And opening your door is one of the simplest ways to do that. Now that help can reach you quickly, we move into the final and most powerful life-saving technique, It involves a medication that many people already have, but rarely use correctly. Used wisely, it can stabilize your heart before paramedics arrive. Used carelessly, it can place you at risk. Let us talk about the correct nitroglycerin protocol in the next section. We have reached the most important step, the one that has saved countless seniors across America. The one that studies show can give you survival odds almost equal to having a paramedic right beside you, but only if you use it correctly. Nitroglycerin. Many people over 60 have this medication in their home. Some keep it in a drawer. Some carry it in a pocket, but very few know the proper protocol when a heart attack begins. And using it the wrong way can be dangerous. Let me walk you through the correct, safe, and powerful way to use nitroglycerin. The moment you feel strong chest pressure, difficulty breathing, or pain that moves into your shoulder, back, or jaw, never take nitroglycerin while standing. This medication works fast, very fast. It opens your blood vessels quickly, allowing blood to flow more easily. But it can also drop your blood pressure suddenly. If you are standing, that drop can make you faint. So sit down first. Then take one tablet and place it under your tongue, not on top, not swallowed. Under the tongue is where the medication is absorbed the quickest. You will likely feel a slight tingling or a gentle burning sensation. That means the medicine is working. Set a timer for 5 minutes. If the pain does not improve noticeably, take a second tablet. Set another timer. If after 5 more minutes the pain still does not improve, take a third tablet. Never take more than 3 within 15 minutes. Let me include an important reminder here. If you are following this step closely, type the word SAFE in the comments. Your comment might help someone else pay attention to this life-saving protocol. Now, there is a critical safety rule. If you take medications for erectile dysfunction, such as commonly prescribed pills for men, you must not take nitroglycerin within 24 to 48 hours of those medications. The combination can cause a dangerous drop in blood pressure. If you are unsure, keep a small medication card in your wallet. Paramedics rely on this information when they arrive. For nitroglycerin to work properly, it must be stored correctly. Keep it in its original amber bottle. Never transfer it to a plastic bag or pill organizer. Light, air, and heat weaken the medicine. Replace every bottle every 6 months. Fresh nitroglycerin should create a small headache or tingling sensation. If you feel nothing, it may be expired. Imagine the scene for a moment. You feel chest pain. You sit down. You begin controlled breathing. You chew the aspirin you prepared earlier. Then you place a nitroglycerin tablet under your tongue. Your blood vessels open. Your heart receives more oxygen. What could have been a complete blockage becomes an event you survive long enough for paramedics to treat. This is not a cure for a heart attack, but it is a bridge that carries you safely into the hands of professionals, a bridge that has saved lives again and again. Now that we have covered all 7 essential steps, let us take everything we have learned and bring it together into a final message of hope and preparation. Follow me into the conclusion. You have just learned 7 of the most important skills any older adult can know. Skills that turn fear into action. Skills that keep you steady when every second counts. Skills that may one day protect your life or the life of someone you love. A heart attack is one of the most frightening experiences a person can face, especially when you are alone. But being alone does not mean being helpless. Being alone does not mean being unprepared. These techniques give you power. Power to stay conscious. Power to protect your heart. Power to survive long enough for help to reach you. Let us remember the essentials. Prepare your emergency communication system. Use cough CPR only in the earliest moments to stay conscious. Chew aspirin. Do not swallow it. Sit upright to protect your heart and lungs. Control your breathing to slow the panic inside your chest. Unlock your door so help can reach you. And use nitroglycerin with care, precision, and calm. These steps are not just instructions. They are acts of self-protection, acts of strength, acts of love for the people who care about you. I encourage you to practice these techniques now while you are calm. Place your medications where you can reach them easily. Prepare your home. Talk to your doctor. Talk to your family. Do not wait for the emergency to learn the skills that can save your life. If this video has helped you feel more prepared, I invite you to subscribe to Life in Words. This channel is here to support you with knowledge, clarity, and hope. And if you feel comfortable, share your experience in the comments. Your story may be the one that saves someone else. Take care of your heart, take care of your mind, and remember that preparation is the greatest gift you can give yourself.